Good morning, I'm Alexis Del Cid, and today we had planned to bring you the next installment in our Week of Love, but due to the harsh weather, we're sharing an Encore presentation instead. Stay safe and enjoy.
All we could do, get in the ambulance, go, and trust.
And that ambulance ride led to a second ambulance ride to the University of Kansas Health System, where Steve Oberhelman wound up with two surgeons working as a team to save his life. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. The man you're about to meet, Steve Oberhelman, loves to bowl. And if you've ever bowled, you know it's a game of strategy. The person with the best offensive game and least mistakes wins. So when Steve was faced with what sounded like a terrifying heart surgery, he wanted the best offensive strategy. And who else than someone who has been both patient and surgeon? If you ask Steve Oberhelman what he likes most about bowling, it's clear.
Strikes.
He's competitive. His wife, Davy.
I'm not a good bowler, but I like the socialization.
Ever since I had my incident here, I have not bowled without her being by my side.
Together, they strike a balance, and a big reason Steve is still rolling, Davy's quick action.
I left this place on a gurney. As you can tell, it's still pretty emotional for me. They said that there's a chance I wouldn't make it.
The episode Steve's talking about came out of the blue in this very bowling alley in these very lanes on June 26, 2023.
I'm feeling pretty good. I thought I might be on my way to a 700 series. In about the second or third frame, I threw the first ball, and it just felt like something right in here in my back.
I assumed it was a muscle spasm.
And I told Davy, I said, something isn't right.
Davy, who lost her first husband to a sudden heart attack, wasn't about to lose the second love of her life.
How could this be happening again?
She called 911 and Steve was rushed to the nearest hospital.
They came out and said, well, we know what's wrong with you, but there's nobody here that can really do anything. Where do you want to go? And I immediately said KU.
And KU was where we wanted to go to begin with.
Yeah.
But they have to take you to the closest one.
A second ambulance ride took Steve to the University of Kansas Health System, where a team of experts led by thoracic surgeon Dr. Todd Crawford would save Steve's life.
Once I got up on the floor, they were rolling me down the hallway, and I looked ahead, and there must have been 20 gowned medical personnel standing there waiting for me. And that's when he came out and he said, hello, I'm Dr. Crawford, and I'm going to be your best friend for life.
They liked that, but they weren't expecting to hear what Dr. Crawford said next.
I'm going to crack open your chest. I'm going to freeze your brain. I'm going to turn off the blood to your body while we fix that arch. And I'm going to sew you back up. I actually started laughing. I said, that's pretty good. What are you really going to do?
Yeah, really. We didn't think you could do that.
It wound up being the first of 3 complicated surgeries.
After they did my repair, they said, well, we kind of got bad news in that vessels are in the way and we can't put the stent in. So we're going to have another surgery and rearrange all those vessels in your neck. And then you'll have another surgery to put the stent in.
The next 2 surgeries required a second surgeon, also at the top of her game, vascular surgeon Dr. Kara Hessel.
We were saying, listen, I got this surgeon. She's great. We're going to be a team. We're going to do it together. And when I came out of the 3rd surgery, I was barely waking up, and Dr. Crawford looked down at me and smiled like he could only smile and said, we nailed it. That's all he said. Then he told me that I was going to bowl another 300 for him.
We are so pleased to have Steve and his lovely wife, Davy, joining us in the studio today. Thank you both for being here. We are also joined by Steve's amazing vascular surgeon, Dr. Kara Hessel. Thank you for making time. We know you're incredibly busy. And we have Steve's thoracic surgeon, Dr. Todd Crawford, who joins us virtually. And Dr. Crawford, full disclosure, we know you're out of town now, but you love Davy and Steve so much. You're like, I gotta do this. I want to be sure to be part of their story, and you're such a key part of their story. So we're glad we're here, and we're all going to need tissues because we'll just pass this around, okay, guys?
Right.
Because this story is amazing. Steve, before we dive into anything, how are you feeling this morning?
Well, in one word, great. I feel great. I am back to bowling twice a week in league. When we go do our walks, I'm doing interval jogging and running. I'm trying to get over to the fitness center so I can be swimming. I've got to start doing that because of all of the cold weather hitting us, but I get in there and I do a lot of swimming laps and so forth. So that's the long answer. The short answer is I'm doing great.
Which is amazing. And you are a couple that loves to play together.
Oh, yes,
play
we
together,
are.
Stay together. Davey, in that moment, at first you thought that Steve was having a muscle spasm. You went ahead and called 911, though. I think you said, my head was in a trash can and I was saying, I'm fine. And you said, no, you're not.
Yep.
What was going through your mind?
Well, first it was like, this can't be happening. I mean, I really did think it was like something small because he was bowling so well. And then he said, well, we'll just go home. And then I thought, well, what are we going to do at home? You don't seem well. And then there was a furor around the people, this is a senior league, so all old people here, were like, whoa, what's happening? And I thought, let's get this.
Don't risk it.
No, I mean, I had one husband die of a heart attack that I wasn't there, and it wasn't going to happen again, so,
And because of that, your guy is next to you. You guys are here.
Yeah.
You're here together.
We are.
Dr. Crawford, Steve had an aneurysm in his aortic arch. I want to show our viewers 2 images of Steve's heart that you shared with us. Let's start with image 1. Where is the aortic arch in here? And for those of us who aren't doctors, can you explain the crucial role the aortic arch plays in the body?
Yeah, even beyond aneurysm, Steve had an acute aortic syndrome, and we might have some pictures later on, but his manifested as what we call intramural hematoma, which is not a dissection in the sense that there's a true and false channel. Rather, there's blood where it should not be, which is in the wall of the aorta. And we treat it very similarly to an acute type A dissection, and we know that time means survival. It's an immediate threat to an individual's life. Here you're looking from the side. This is a sagittal view on the CT scan, and this is after we've done all 3 operations on Steve. But you're looking, that stent is landing in zone 2 and zone 3 of the aortic arch, which is just beyond the left carotid artery.
When you say dissection, does that mean there's a tear in his aortic arch?
Yes, and often that is the case with an intramural hematoma as well. There is a tear in the inner lining of the aorta, which allows blood to either dissect into a false channel, or it can be a limited amount of blood in that space, which we call an intramural hematoma.
We have a second image to show our viewers. And again, I'd love for you to explain to us the area of concern. It just looks like a bunch of lumpy stuff in the center. What are we looking at there?
Well, actually, this is after his first stage of repair. This is the operation I performed. So this is a coronal view. So looking at him straight on with him standing up of his aortic root, ascending aorta, and the first part of his arch. You can see that large branch coming off the aorta, which is the innominate artery, which goes to the right brain and right arm. And so this is after his initial reconstruction. And we'll talk a little bit more about the decisions that were made at that time and why they were made.
And they were big decisions. When your aortic arch is leaking blood, then the biggest risk, obviously, you're in mortal danger. What would happen if untreated?
Yeah, so with a type A dissection, which means it involves the ascending aorta, the risk of death is about 1% per hour, or 50% at 2 days, with conservative management. And so typically with either a dissection or intramural hematoma, the decision is to operate, and it's all about when. In a dissection, or even in an intramural hematoma with high-risk features, I usually take the patient immediately to the operating room. Doesn't matter what time of day, because our team is excellent and always ready. With Steve, he actually looked pretty good when he showed up to the hospital. I reviewed his imaging. He had an intramural hematoma rather than a true dissection. His intramural hematoma thickness was less than 10 millimeters, and he did not have blood around the heart, which is called a pericardial effusion. And so I recommended waiting and allowing that tissue a little time to firm up. When we treat an acute aortic dissection, especially intramural hematoma, that tissue is like wet tissue paper that we have to sew to. And what makes it especially challenging in an intramural hematoma is that you have to get all the blood out of that false area, the inner wall of the aorta, before you can put it back together. And the risk of tearing it or creating more problems is pretty high. So that's why we waited a little bit with him.
When you say wet tissue paper, it's like sewing wet tissue paper. That I get. That would be impossible. And that gets us to the surgery. And I want to reiterate what Dr. Crawford, you had to do in the surgery to Steve. And I can see why, Davey, you thought, I don't even know that's possible. You stopped all the blood flow to Steve's brain for 36 minutes. When you hear that, what were your emotions like going up to that surgery?
Well, the day this all happened was rather chaotic, getting gurneyed out of the bowling alley and being at the first place and having a bunch of tests and then getting another ambulance ride. It was in that ambulance ride that I realized the severity of the situation. And I realized that the only thing I was going to be able to do, I couldn't control my life. I had to trust, and I had to turn my life over to these strangers that I was just about ready to meet. But it didn't take long after I met Dr. Crawford, and he told me about his experiences, and he told me about what I can be expecting, that I had such a strong connection to him. So I started feeling really pretty good about that, and I wasn't really focused on the things you just said. And then my daughter showed up, got here from Rochester, Minnesota. She is a physician. Her and her husband are physicians at Mayo Clinic, and she got here and spent some time talking with Dr. Crawford and the other group. And when she came out, she gave me the thumbs up. And I said, I'm at the right place, and it might not be the right time, but I got the right people working for me. So at that point,
Amen.
I just had to jump on it and put my faith and trust and everything else in these incredible doctors and nurses that were taking care of me.
You mentioned when Dr. Crawford shared his personal experience, and I'm going to ask you about the process of stopping the blood to the brain and all that in a second. But first, Dr. Crawford, you do have a very unique perspective on this surgery because you've had this surgery yourself.
Yeah, I had a very similar operation. Now, the circumstances were quite a bit different than Steve's. We know from national data that the risk of mortality with this kind of event is 10 to 20% with repair, even in the best hands. And it's much different in an elective setting. When you come in from home, you're optimized, and it's a very controlled situation. The blood being cut off to my brain was a much shorter period of time, and that's because with Steve, we had to reconstruct his arch. He had a 270-degree gap between the two layers of his aorta. So the first thing I do is I reconstruct that using a piece of felt, and I essentially recreate a middle layer, sew those together, and that takes a fair amount of time. And then I sew my polyester graft to that recreated aorta. So that's where the 36 minutes comes from.
Dr. Crawford, you're always modest about what a great surgeon you are, but you do have this personal connection to your patients for what sounds like a really scary surgery if you're the patient. When did you have that procedure done? You were in med school, right?
I was in fellowship training. I'm coming up on 4 years now.
Yeah.
And it is a little bit of a unique perspective in that, I've been through that process. I know what that recovery looks like. And, the truth is patients are scared, and rightfully so. Heart surgery is a scary thing, but, for us, it's a very controlled environment, believe it or not. And I know that even though 36 minutes seems like a long period of time, his brain is cold. It doesn't require any oxygen at that point, and I have time to work and not worry about that.
And that allows you to do your magic. And then we have we call it magic, those of us who aren't doctors, but you are. It's not magic, it's complete, it's training and perfection and knowing what you're doing. And that brings us to Dr. Hessel, because that's when the other big gun is brought in. Dr. Hessel, Dr. Crawford realizes, I'm going to need another surgeon, a vascular surgeon. So Dr. Hessel was brought in for 2 more surgeries. The first one was to rearrange the blood vessels in Steve's neck. How do you do that?
So the big thing with all of this is that we're trying to treat the entire portion of the aorta that is damaged by the intramural hematoma. And in order to do that, we have to address the portions of the aorta that have blood vessels that are coming off of them. And so we have to take a bypass from the carotid artery that Dr. Crawford has already addressed and take the bypass to the left subclavian artery, because we have to cover with our stent graft, which is the 3rd procedure, that portion of the aorta in order to treat the entire diseased segment. And so with that, we can actually take that bypass and restore the blood flow to the arm and decrease the risk that there's any kind of long-term complications as far as paralysis and things like that go with our stent graft.
Davey, you're hearing all this for the first time when you're in the moment.
Yes.
Was your head spinning? How were you able to grasp any of it? Because I wouldn't have been able to process everything happening in the moment.
It happened so fast,
Yeah.
and we did have an immediate connection with Dr. Crawford. I mean, he put us at ease. There's something so genuine about him, and then family came, you know. His daughter, you know, she would know about this too. She seemed comfortable. And
Steve's daughter.
we just had a lot of family, and
Did you get to meet Dr. Hessel before the 2nd and 3rd surgery?
yes.
Okay,
Yes.
so
Our first visit was actually virtual.
Yeah.
okay.
Yeah.
And did you have to explain everything virtually, what you were going to do and how
Yeah,
you
we
were going to
talked
go
about
in?
it. Yeah, kind of like
Over my head.
Right.
I mean, when
Right.
they say the risk, they're always like, okay, but you know,
It's the risk of not doing it.
you do. I'm not a terribly religious person, but it was trust. I just trusted. And also, when my first husband died, I wasn't there. Nothing could happen. I just felt like this time we'll do the best we can. you
Right.
know. So, you
Right.
know.
Dr. Crawford's the one that said on my follow-up visit, like 30 days after the main surgery, he said, we got to do this, and I've got a surgeon for you. And he gave the name. He said, you've got an appointment virtually with her tomorrow, and we got a slot for you on Thursday to come in. And we're like going, okay. But
how
he
great.
said,
It was all done. It was
Yes.
all lined up for you. And
he
set up.
said, I really like this surgeon. She is great. That's all it took. And then Dr. Hessel followed up with great on-care, after-care. I always enjoyed you coming in and visiting me, because you're not like Dr. Crawford that I can get to right away. You're a little bit. You didn't want me to hug you.
Oh, she played hard to get.
My daughter. I'm not a hugger, Mom.
Right. You felt such a deep attachment to both your surgeons, though. You
Oh,
want to
yes.
reach out and wrap your arms around them.
Well,
That's
I
a
do-
testament to Dr. Hessel that you brought out that response from them.
Oh yeah, well,
Yeah.
and this is how she acted every time we would talk about it in the room. That she just
Aw, shucks.
really, yeah, exactly.
Right. Well, I've heard that before from Dr. Hessel's patients. They say,
Yes.
you know, she's very modest, and then she does this magic, life-saving in the operating room, and it's
Well,
incredible.
both of these surgeons
Yes.
have that in common. They will not toot their own horn.
Didn't you say Dr. Crawford said you had to call him Todd?
Yes, he does. The most I can, if it's private, I can call him Todd. But normally, the best I can do is call him Dr. Todd.
Okay. Yeah, you did say that during the interview.
I think it's because we're old.
Yes.
And you know.
I know
It's
what
a
it took
sign of respect.
for them to get
Yeah.
to where they are, and the studies and the work. I mean, I've saw it firsthand with my daughter, and there's a certain respect that I feel I should be giving. But we figured it out. I think Dr. Todd and I figured out a nice way to communicate, and,
Right.
and it's very good.
We have some great questions coming in from our viewers. If you have a question or a comment, just send it to us on YouTube, Facebook, or the All Things Heart email. You'll find all the links right there on your screen, and you can connect with us in real time. We will read your messages and questions. Dr. Hessel, I have a question for you. When you're rearranging the blood vessels, this is probably oversimplifying, but as a layperson, how do you keep the blood vessels from going back into place?
So when we do the surgery, the bypass actually runs from the carotid artery in the neck and then down to the subclavian artery down here, just above the collarbone. And you have soft tissue that's there. You have some muscles that kind of sit in that area. And so when we put the bypass in, we still close down the space that's around it, and that kind of keeps things from moving. But we have to be careful when we do it because, you know, your neck is a very mobile structure. And so when you turn your head from side to side, I don't want the bypass to kink. So we have to make it, you know, because otherwise you could pass out every time that, you know, you
Turn your head.
turn your head. But the idea is to get it exactly the right length so that when you turn your head from side to side that you're not having any problems with it.
Where do you go in to do this? Where do you go in through?
So his incision is right here at the base of his neck, right above his clavicle.
I can't even see it.
I know.
He
my
healed really
glasses on.
nicely.
Let me see it again. I'll see if I can see it with my glasses. Yeah, I can't even see it. I don't know if you can zoom in, but that's really good work. You're
Yeah.
like an artist.
Yes.
There's no scar.
Well, the day after you could see it.
Yeah, you definitely
Sure.
can see it.
Are you sore? Were you very sore when you woke up?
No, not really. Not really.
How long was the procedure?
It usually takes a little under 2 hours.
Okay.
Yeah.
And then Dr. Crawford, after that second surgery was performed by Dr. Hessel, you then assisted Dr. Hessel with a third surgery during which you placed a stent into Steve's aortic arch. So was the third surgery the one that you both were in the operating room together, the only one where you were together working on him?
That's correct. That was the curative operation. And I just want to reemphasize what Steve said. Dr. Hessel is very modest. She's excellent. And, you know, there's a reason why KU is special for treating these acute aortic syndromes. And that's because, you know, I realize I have limitations in what I can do as well. And having someone like Dr. Hessel to lean on to carry Steve through to the finish line is so important. And I think that's what's really unique about our aortic centers. We work very well together, and we have a solution for almost any problem.
You have each other
You know,
at the
the reason
fingertips.
why we had to do Dr. Hessel's second procedure and then the stent is because the reason Steve had an acute aortic syndrome, that intramural hematoma, is because Steve had an ulcer at the very end of his arch that was leaking. And when he came back to see me after a month, he had healed up well from the repair I did in the front, which was the life-saving operation, but that ulcer was growing. And when the ulcers start to grow like that, we know there's a real risk of rupture, which can be fatal. And so in order to treat it, first we had to develop a landing zone for our stent, because when we deploy the stent, the way it works is it has to seal up against the aorta. There can't be any gap around it. And we typically need at least 2 centimeters. Sometimes we cheat a little on that, but 2 centimeters closer to my graft than the ulcer is. And in order to facilitate that, Dr. Hessel rearranged the blood supply so that we could cover that left subclavian artery, or the artery to Steve's arm, and then get a good seal.
All these surgeries happened summer of 2023. End of June is when this started. So how long was it for you to finally go back to bowling? I know you were bowling yesterday.
Well, after the first surgery, Dr. Crawford said that I needed to not lift anything over 10 pounds for 3 months. So I calculated it, and that would be October 1st. And we were in the bowling alley October 1st, and I was bowling.
I was worried for a second you were going to say you were only using 8-pound balls.
So was I, actually.
And I was thinking, oh gosh, don't say you still went bowling.
I was throwing my 15-pound ball.
3 months later.
Yeah.
Okay. And have you made it that to 300, like Dr. Crawford told you wanted to?
No,
Not yet.
Now, of course, keep in mind that a perfect game is a difficult thing to do. Probably not as difficult as what they did here to me, but it is a difficult 12 strikes in a row, and I've only thrown 2 of them in the last 10 years. So I think I've gotten several that I've gone 7 and 8 strikes in a row, but I can tell you I have imagined the day that will happen.
I have a bowling question, not medical, but you say, oh, I've bowled 6 or 7 strikes in a row. At the level in which you're both playing, does anybody ever do a gutter ball?
Oh, yes.
Oh, yes.
Oh, really?
Yeah. Oh, yes.
Okay,
yes,
okay.
Yes.
So there are humans.
Yeah. There's actually I've thrown 1 or 2 here lately.
Actually, when we're talking about the 300, a couple weeks ago, Steve was on track to have a 280.
Oh,
A
wow.
280 is what happened when he had the incident.
Oh.
And he said, if I do 2 more, I'll have a 280. And it was kind of like,
Did you say
Didn't want that.
That's when you did the gutter balls?
No, not a gutter ball. He did a
tanked it.
spare.
Yeah.
I tanked it on purpose. Yes. I don't want to offend any of the bowling gods.
Still, Davey, and before we get to our community questions, you've been through so much. How did you navigate emotionally the 3 surgeries as his spouse? You're in the waiting room the whole time. You're the one up at night, your mind's going like a hamster wheel.
Well, I was either his daughter or I was always in the room with him. I mean, he was never really alone for very long.
Okay.
And then when he first came home, he had to sleep on the, we have one of those pull-out kind of couches, and then I slept on a pop-up bed right in the next room, so I was always there.
Yeah.
And we were so happy to be back home, and that feeling like everything's going to be okay. We went for a walk the next day, so it really,
nice.
It was fine. You just, like I said, you just trust.
Just like the ambulance ride. You got in the ambulance and trusted.
Yeah.
Yeah.
We have a question from Jeremy Yenser, our community questions. Jeremy wants to know, does what happened to Steve have any warning signs leading up to it, or does it just happen all of a sudden? Do you remember warning signs looking back?
I'd actually had an echo and a stress test in February, and there was nothing seen. At that point, they did put me on some lighter weight blood pressure medicines, but otherwise I was active. I was riding my bike. I had no clue. It just like that, and I felt it.
Anne wants to know, I'll ask Dr. Hessel this, how does the body handle being under anesthesia that many times in such a concentrated period?
So that is something that we do have to consider, and that's part of the reason that we give a little bit of time in between the procedures. You can do the second and third portions, what we did with the rearrangement of the blood vessels and the stent at the same time, but there's a little bit more anesthetic time built into that, and then it just becomes a little bit more complex from like a stroke standpoint. And so we try to separate those to give the body a little bit of a break in between those procedures then. But the total anesthetic time, Dr. Crawford, how long was the first operation, would you say? I know you said you shut off his flow for 36 minutes, but...
Yeah, I think it was somewhere around 5 hours.
Oh, wow.
Okay. And then, the
5 hours.
The second surgery was a little under 2 hours. The third surgery was probably about that long too, when you consider all of the things that go into setting up for it and everything. So, that's a pretty extensive amount of anesthesia, and so definitely something to consider. People can get confused and everything after that much anesthetic, and so we have to watch things closely.
I would love to keep this conversation going for another 3 hours, but we have to get to some final thoughts, and I want to start with Steve. And before we do that, I want to share something that Steve said during our initial interview about how you were fighting for yourself, but you were also fighting so hard for your family.
During this whole time, my son and his wife, they were pregnant with their twins. They'd already lost their first set of twins. I made it and they made it.
And here you are with those new twins, the grandbabies, and who are the other 2 young kiddos in the picture, Steve?
Well, sitting next to me is Adeline, she's 10, and sitting next to Davey is Caleb, he's 7. They are the children of my daughter. They live in Minnesota.
How beautiful.
Yes.
And you are now surrounded by the people who saved your life. You have Davey to your right, Dr. Hessel to your left, Dr. Crawford on the screen there. What do you have to say to this team?
Well, I think these two great surgeons, these great doctors, these human beings, would attest that I'm not shy about letting them know how I feel about them. And every time I see them, or talk to them or text to them, I let them know just how important they are. But I want to take a minute because they are as good as they are because of the team, their team, and the cardiovascular team that took care of me. The doctors and nurses in the OR, the nurses, look at fabulous nurses in the ICU, the great nurses on the floor of the cardiovascular in the hospital. They come to me with a push of a button. And the rehab people in the house and outhouse, they all work so hard to get me to where I am. And even, it might sound strange, but the man that delivered my food to me every day, morning, noon, and night, he would come in with the greatest smile on his face and a laugh that was infectious and just made us feel so great. So it's all of these people that I want to thank from the bottom of my heart.
It's beautiful.
Now, you said about Davey. Well, Davey hears this same spew about 6 times a week. And it's, like she said, my daughter and her took turns. I was never alone. In the ICU, they were with me 24 hours a day. They figured out how to sleep on that bad chair. In the other, it's an upgrade, but they were there for me all the time. But when we went home, it was Davey and I. And as she said, she was on a pop-up bed, jumping if I got up, because I wasn't supposed to use my arms or anything. So she was there all the time. So we have become inseparable since that time. And so what do I have to say? Well, I'm thankful that she's my life partner for 20 years. She's my wife for 5. And Dr. Todd, I'm sorry, she's also my best friend for life.
Yeah.
And I love her now, and I'll love her forever.
Oh, Davey, that's beautiful, Steve. Davey, anything you want to add?
Well, Steve and I did get married 5 years ago, and in our vows, I said, you know, this is not like getting married when you're in your 20s. We kind of know what's in the future, and we do the best we can for each other because you never know, but you just do the best you can. And we are best friends and partners, and so I couldn't imagine not being there with him, you know, and that's just how it is.
Dr. Hessel, you played such a key role in keeping them together. Anything you'd like to say?
I just think that, you know, the trust that you guys have shown in us is amazing, and I personally am just so thankful for that because it allows us the opportunity to really feel, you know, enabled to do the things that we need to do and to get everybody through what we need to get them through. But the effort that you've put into it has just been incredible.
And Dr. Crawford, we know you have a very special tie to Steve and Davey. What do you want our viewers to know about this amazing couple that's sitting here today?
Well, I've gotten to know Steve and Davey pretty well over the last year and a half, and they are amazing people. You know, that their love for each other is palpable, and you know, Steve has a wonderful family as well that I got to meet. And, you know, it's so important in terms of the rehabilitation to have that companionship, somebody by your side through the ups and downs. And, you know, we didn't get into it today, and, you know, I don't want to share too much for Steve, but 2023 was not the best year for him, in addition to all the things that happened with his aorta. And, you know, he just never stopped working hard to get back to where he wanted to be. And, you know, I just want to say one other thing that he emphasized, and that's the team effort that went on at KU, you know, spanning multiple disciplines, our incredible ICU and step down units that, you know, got Steve back to where he needed to be to get home. And, And, that's the privilege of working here, is having those people on your side. I can drop him off in the ICU after a long operation like that and go home and not worry, because I know they're going to take excellent care of him.
That's fantastic. Thank you for taking the time to join us, Dr. Crawford, Dr. Hessel, Steve, and Davey. Sharing your journey has been such a privilege for us to hear your journey and that you shared it with us. Thank you for joining the conversation with us this morning. And if you'd like to watch or share any of our previous episodes, just scan the QR code on your screen right now. It'll take you to links of all our previous episodes.